Yeah.
after that. I guess we have a couple minutes, don't we?
Yeah, well, 1 minute, I show
Okay.
1 minute.
Yeah, that might be a little slow.
Since we have 1 minute, I'm gonna look, okay.
At this?
I don't, yeah.
Yeah, I'll
Just
take
in
care
case
of
of, well, you'll have it on for just in case I go back.
it. Okay, yeah, just the back button.
Figured it would be pretty self-explanatory, but.
Are we ready?
Yes,
Okay,
1 o'clock.
good afternoon.
We're here for our 1 o'clock budget hearing in the Health Department.
Good afternoon, Commissioners. It seems strange to say that. Usually we say good morning. I'm Linda Oakes. I'm the Director of the Shawnee County Health Department. We're going to give you our budget request and also just give you an update of some things we've accomplished and our goals for next year, kind of our dreams, too, of what we'd like to do. I'll just start out by saying that this budget's been prepared by the entire management staff that you see here today. I'll introduce them in a minute. It was based on our anticipated needs and our strategic planning. We're confident this budget is as accurate as can be expected in this point of time, but also recognize it's important to continually seek ways to improve operational efficiencies and effectiveness. So we continue to be committed to conducting business with integrity. We are respectful and compassionate in meeting the needs of others in our community. All employees of the Health Department are empowered to actively contribute to the success of the Health Department. So I'll start out with our current organizational chart. It looks very much like last year's organizational chart. No big changes this year, I'm happy to report. The one change is you see, I guess I'll do this over here, that might be easier. The Community Health Planner is our new position, and that person, Susan, is reporting directly to me at this time. There's a good chance that she will be moved under the Community Health Outreach and Planning Division next year, but for right now we started with her under the director. So I'll go through each division and introduce the staff to you. First, we have Finance and Administrative Services, and that's Edith Gaines, that division manager. She oversees finance, purchasing, payroll, maintenance, quality improvement, medical records, support services, risk management, billing, accreditation, and the new EMR. So she's quite busy right now. Just got done with accreditation, now we're jumping into the EMR. So, yeah, we'll have to give Edith some time off when all this is done. Next, we have the Family Health Division, and that's Teresa Fisher. And Teresa oversees the Nurse Family Partnership, newborn nursing home visits, First Steps, which is our social work home visit program, the Fetal Infant Mortality Review, Baby Basics classes. So we like to call Teresa our queen of contracts. She has many complicated contracts that we get to bring to you, and she's working on, I don't know, 5 or 6 right now. So we keep her busy with contracts. Next, we have the Clinical Services Division, and that's Carrie Delfs is our division manager. She oversees communicable disease, immunizations, the Sexually Transmitted Infection Clinic, Tuberculosis Clinic, Women, Infant, and Children WIC program, Environmental Health, and Child Care Licensing, and also soon to be Family Planning. So she's also, everybody's really busy, as you can see. And Andy Graham is also here. He is our Health Protection Manager. He is the direct supervisor over environmental health and then also supervises the Child Care Licensing part of the program. And you might remember we reclassified that position to have Andy help us in the transition between not having a separate division manager for that division. So with his 30-plus years of experience, he's helping us with succession planning. So I anticipate when Andy does retire that position will go away. So we'll go back to team leaders. And then now we have the Community Health Outreach and Planning Division, and that's our own Craig Barnes who's in charge of that. So he has public information, health protection, community health planning, epidemiology, emergency preparedness, and the Medical Reserve Corps. And Craig was just sharing with us today that he's had almost twice as many media hits or media posts to date this year than we had all of last year. So we had 39 media posts last year total, and we're up to 59. So he had how many requests when the Tobacco 21 decision came down that day?
13.
13 requests that day. Some national news picked it up. And then so when he did the rabies media release last Friday, the San Francisco Chronicle and the Des Moines Register picked them up as stories. So We're famous. I don't know if we want to be famous for rabies, but anyway. So really pleased that that is happening.
Be famous for.
Yeah. And then we have Nancy Mitchell here today. She is the Corporate Compliance and Risk Manager Coordinator and Accountant 3, and she actually developed this budget this year, and she's going to talk a little bit about some changes in the grants this year. So across all areas, we have strategic planning, performance improvement, health promotion, accreditation, and workforce development. So everybody works in those areas. But this is how we have it organized, and honestly, Commissioners, I don't see a lot of changes in this in the next year or two. This is seems to be functioning very well this way. So, all right, so our strategic plan. So this is our strategic plan for this year. We did make some updates to it. I anticipate next year's strategic plan being quite a bit different. It'll be interesting to see. With the Community Health Improvement Plan coming out, that is our guiding force in this strategic plan. So I'll just quickly review some of the changes we had in our strategic plan this year. So we did change one of our priority goals. It used to be quality of life. We changed it to health equity. We felt like it was important during this time when we're hearing a lot about inequities and health disparities that we focus on that area to improve the health of the entire community. So that priority goal is now promote and protect the optimal health of all people in Shawnee County. And then under Objective 1, which is supporting the goals and objectives identified in the Community Health Improvement Plan, we added Strategy 1.4, which was to create the plan. So that is happening right now. And Thursday morning at the commission meeting, Susan, our community health planner, is going to give you an update on what's happening with the Community Health Improvement Plan. So, and then under Objective 2, which is coordinating health promotion and outreach activities, we added to ensure public health preparedness and readiness under 2.4. So that part of CHOP was not in that goal, so we added that, that strategy. And then under Objective 4, which is create a culture of quality, we added 4.4, maintain strong and sustainable fiscal management. We've done that, but we added that in here, first of all, because accreditation required it to be part of strategic plan. So there's one of the benefits of accreditation is that we've strengthened that strategic plan. So this is the strategic plan. All of the health department employees had a role in creating this, and they will again this year. We'll start this fall with the new SWOT analysis and then go from there. Another change in the strategic plan was to add this objective number 3, which is to address the social determinants of health by following the guidelines of Public Health 3.0. We thought it was really important to talk about, again, the social determinants of health and also to emphasize that Public Health 3.0, which is really the point of Public Health 3.0, the biggest, I think the biggest point, is to see the health department as the chief health strategist. And I think we have embraced that role. There's so much going on right now, and that's another reason we're getting a lot of media, is that we're expanding, we're meeting the needs that we're hearing about, and we're helping connect people. We're helping connecting those groups. So when there's groups working on areas that we know are coming out in the CHIP, and they're not under the umbrella of Heartland Healthy Neighborhoods, we're reaching out to them, and we're helping partners do that. So I think there's just a lot of good things happening in that area. So the first strategy was to hire and orient a community health planner, and we've done that. The second strategy was to use granular and actionable data to guide policy and programmatic development. So again, as we look at new programs, as we change programs, we're looking at the data, and that needs to drive it. And strategy 3.3, engage a wide cross-section of partners, including policymakers, to progress towards health equity. And so we have really, I think, we're living that. We're going to use partners, we're going to collaborate, and people are excited and they're enjoying their work with us, and I'm very thrilled that it's happening as much as it is. So any questions about the strategic plan or our goals and objectives at this point?
No.
Not yet.
Okay,
Yes, ma'am.
not yet. Okay, so briefly we'll go over a few of the accomplishments we've had through the last year. We completed the Community Health and Needs Assessment. So Stormont Vail was the lead agency on that. We were a partner with them. They hired the consultant and led that effort. Just for example, we received 2,324 surveys for that Community Health Needs Assessment. That is more than twice as many as we had last time. So I really feel like a lot of the credit for that goes to our staff and just hustling and getting that survey out and really encouraging people to complete that. So that is done. we had our inaugural Community Health Awards. So we had Lisa Martin win the Individual Health Champion Award, Topeka Housing Authority, that's Trey George there, with the Organizational Award, and then our own J.P. Lewis Award of Excellence for our staff member was Clara Norris. So we look forward to continuing that award as we go through the years. We partner with Topeka Community Foundation, and I know you know this, to hire a community health planner. I'm just really excited with what she's doing and how well she's doing. She's getting out, she's working on the CHIP, she's meeting people. I think we are a pioneer in this area, and so I think it's really exciting that we're doing this, and I think we're going to see a lot of good come out of that. We created and submitted 261 accreditation documents, and everybody in this room will go when I talk about this. There's a tremendous amount of work. And just for example, so we had to either create or update the following plans: the Community Health Improvement Plan, Community Health Needs Assessment, the Workforce Development Plan, the Strategic Plan, the Marketing Branding Plan, the Performance Management Plan, the Quality Improvement Plan, Risk Communication Plan, Continuity of Operations Plan, Emergency Operations Plan. That was just the basics of accreditation, and everything else flows from those plans. So we have a lot of great plans, and we're going to use them. That's the next great part about plans, is that you implement them. And so they've all been implemented. Again, we were doing a lot of the work. We just didn't have the plans, we didn't have the documentation that we needed. So accreditation has really sharpened us in that area. We have the documentation now. So that was great. So those were, I think, some of the bigger highlights. So what's happening this year? So we anticipate the next year our accreditation site visit will happen. That graph is what I sent to you each week in the report that shows all our documents done. That was pretty fun to get that to all 100%. We anticipate our site visit probably right after the holidays. That's kind of what we're hearing from other agencies. And they will invite you and ask you to participate in some of that. I don't think you have to be there the whole time, but they will ask your participation in that. They'll probably be asking you about communication and that kind of thing with us. So we are waiting to see if they reopen any of our documents at this point, and then they will go ahead and schedule our site visit. And then after the site visit, we should hear whether we're accredited or whether we get put on an improvement plan. That does happen sometimes. We're hoping it doesn't happen to us, but we will deal with whatever happens. And then the implementation of the Community Health Improvement Plan. So again, you have the update coming on Thursday. I'm really excited to see the plan this year. We really want this plan to be something we can measure, that we can use as our guiding force, that we have lots of community input, and I really feel like that is happening. So I'm very excited about that, and more about that this week. So the other project that we want to talk about is new positions that we've put in our 2020 budget. We are really a people organization. We don't have equipment. We have people. So these are some of the positions that we wanted to talk about. So Tim is here from Parks and Rec. And so the first thing I want to talk about is the possibility of a shared grant writer. I have been dreaming about this since I became the interim director. I see so many great possibilities to have that shared grant writer, because there's so many times when the health department and Parks and Rec can intersect and work towards better health for the community. I just think that's an integral part of what we need to do to improve the health of our community. I think we have great parks, we have a great department, so it's time for us to work together more. And so this is our proposal. We're not big on details yet. We haven't quite worked out all the details, but we just know it's a great idea and we think it's a great possibility. We're looking at a Range 14 Step 1, which would start at $19.89. That was what we had talked about. And just so you know that, so Craig keeps a database of this, and since March of 2018, we could have applied for up to $620,000 in potential grant money, and we didn't because we just didn't have anybody to do it. And so there's been lots of opportunities. And when you talk about social determinants of health, that is out there. There's money out there. And so I want to be able to access that money and work on that. And I think a half-time in both departments is a great start. It's that shared responsibility and shared burden of finance, but then it's a smaller start than one full-time in each department. So that is kind of the dream about that, is that looking at those partnerships that we can do, and we can help improve both departments. So that's one position that we'd like to talk about. The next one is the maternal and child health registered nurse. This is not a new position. This position has been in our budget for several years, but because of the aid to local grant, we weren't able to fill it. Because of the match requirements that Nancy's going to talk to you about here pretty soon, we need to fill it this year to get the full grant. So we've had a nurse opening in Nurse Family Partnership since about February. It's very difficult to hire nurses right now, and I'm well aware of that. And we did a little research. So we start nurses at $22.96 an hour. Stormont is starting about $25 an hour, and St. Francis is starting around $30. So that's, I mean, we're not too far from Stormont, but we're pretty far from St. Francis. Stormont has 27 RN openings right now and 60 total nursing openings. So that's a lot to compete against. And they also do loan forgiveness, so that's something else that's hard to compete with. So we know there's some competition, so we look for other ways to make these jobs appealing. You know, no holidays, no weekends, no nights. You know, we're family friendly. We do all we can to help make these jobs more attractive than just the salary. So this nurse, if we are able to hire another nurse, we would have more outreach opportunities. We could do more partnerships with the Children's Palace, with the Learn and Play bus from the library. There's just lots of other partnerships that we constantly get requests, and so I think it would be great to be able to do some of those. We could expand the baby basics classes. We could have new locations. We're going to try to get over on the east side later this year, but we could have multiple classes going at once, different start times. Our class that starts tomorrow is full. I mean, it's a popular class, so we'd like to be able to expand it. The SCRIPT training, which is the Smoking Cessation and Reduction Pregnancy Treatment Training, it's a one-on-one meeting with clients based on an evidence-based program to help pregnant women quit smoking, and is reimbursable through Medicaid, so we would like to do that. And then more work on the Healthy Babies Work Group, which is part of Heartland Healthy Neighborhoods and the Fetal Infant Mortality Project. We were talking about how can we attract more people on the review team. So this person would be working on these items. So not Nurse Family Partnership, it's the other side of the MCH program. And then this next position would be a new health promotion specialist. This would be a person under Craig in his department. I'm not exaggerating when I say he and his small staff are running night and day to try to keep up with all this going on in health promotion with the media, and then we were talking this morning, that's almost been a full-time job this last couple of weeks as the public information officer. But there's so many requests for education. We can do more work as far as tobacco use prevention, the food security issues, we're going to be working on that. It would be partially funded with the Chronic Disease Risk Reduction Grant. Right now it's at 40% at this. This salary was set through the CBIZ study. We had an open PCN then, but we didn't have anyone in that position. We think it's high. We think we would want to come in lower. So we would be talking to the union and HR about that. So it could be possibly a higher percentage funded by the Chronic Disease Risk Reduction Grant. So there's just plenty to do in that area. So I think that would be a great help to that department. And then the Family Planning APR in, this person would be part-time. When you see the aid to local, you'll see we did not receive as much as we asked for, which we didn't expect to receive quite this much, but I thought we might receive a little more than we did. This person would be the mid-level provider, and so we can work on part-time, and we budgeted at half, and so we would probably go lower than that. So the nurses that we have will be doing a lot of the groundwork. This person would be doing exams. And again, I refer you back to the survey we did about family planning. Over half the people that we surveyed said that they would come to the health department if we offered family planning. There are gaps in services in the community in the family planning area. There are types of birth control that women without insurance cannot easily access right now, and they're going to Douglas and Riley County, some of them, to get it. And again, that's not convenient either. So it's not like we just said, oh, we really want to do family planning. We knew there was a need, and we also did the survey to see what people thought. And the folks that were surveyed were our STD clients, our WIC clients, and we put it out on Facebook. The other thing we can do through family planning is test for STDs, so we can have more testing done and hopefully help that rate too. So I do think there's the need for this. It's going to be a lot of work, but I think we need to do it. So those are the new positions that we wanted to discuss with you. Do you have any questions so far, or comments, suggestions?
I remember when you got the job, Linda, I told you to think big, be proactive, and be aggressive. I'm starting to regret that I said that to you. No, good job.
Thank you.
Good job. Commissioner Cook, do you have any
Oh,
thoughts for Linda?
I mean, I think that, Topeka and Shawnee County has its fair share of issues with community health, and we are working to try and address that. A concern that I have now is our outlier counties, Jackson, Jefferson, Wabunsee, Pottawatomie, Osage. As those individuals reach need for health care, they're going to come to Topeka because Topeka has much more health care options than those outlier counties, which will then contribute to our overall health factors and how we're looked at. And so trying to think maybe even bigger than we are now, how are we going to reach out to those other counties with we look at all the programs that we have. I know that Osage and Jackson and Jefferson, we do a little bit with WIC, we do a little bit with some of the programming, but are we really reaching the majority of what we could? And is there a possibility in forming more coalitions to help offset that cost of care? I mean, if we're already doing the program, it doesn't need to reinvent the wheel,
Right.
but there might be a reach-out program or interlocal agreements with other counties for what we're doing, similar to what WIC is. And so just trying to think even bigger to fund some of those positions.
I think that's a great idea. I can tell you that the Wabunsee County Director, because we do WIC there, already asked me, what's the possibility of doing family planning over here one day a month? So they're thinking that way too. And I think that's good. Any collaborations are great. And I think a lot of, especially for family planning, some of those women are going to come here for it because they can't access it. But I think some of those counties have family planning. I just don't know how much they're open.
The grant writing, I guess my cautionary on the grant writing is, as with any grant, you can often use as much time in monitoring the grant than what you receive in the grant. And so
Yes.
it's one of those things, you get $1, but you spend 75 cents in administration, so you really only wound up getting a quarter.
Yes.
And so is it the most efficient use of your time? And that's just my caution on grants.
No, you're right. Is there a payoff?
Yes.
And what is it? That's a good point.
I agree with that.
Commissioner Rippon?
Yeah, the grants, are most of these like a matching grant?
Do you want to talk about some of the grants you've seen? Can you off the top of your head?
Be more than happy to. Find my paperwork here. Craig Barnes, Health Department. I didn't know exactly what I should say when I come up to a budget hearing. That's the first time for me up here. So with the grants that we've been looking at over the, when I started the database back in March 2018, the grants that we're looking at are either federal grants or through community, like health foundations, so the Kansas Health Foundation. A lot of these particular grants are different than our state grants, like through KDHE, and they don't have the same matching requirements, and they don't have as robust of the reporting requirements. So to your point where, we're looking at maybe 75% of the administrators, so we're only getting a quarter out of it, that's not the case with the Health Foundation grants. Now, if we look at larger federal grants, that is where that comes into play. There's a lot more reporting that goes into those, and we're looking at a longer period of time. That goes also to when we look at larger grants through larger national foundations like the Robert Wood Johnson Foundation. Again, there's going to be a lot of reporting that goes on to those, but the biggest thing to realize with those is those aren't just health department grants that we would be doing alone. Because a lot of those grants require you to meet a certain capacity to where you have a community health improvement plan in place. You've done a needs assessment, that your community health coalition is functioning, and it represents 12 separate sectors of the community to make sure that you have the capacity within your community to actually make movement on whatever it is that you're proposing. So that wouldn't be something that if the health department was to apply for, say, a Robert Wood Johnson Foundation grant, and we were the fiscal agent, there wouldn't be just the health department that then ultimately would be doing just the work. We would do a lot of collaborative projects with Parks and Rec, with Heartland Healthy Neighborhoods and the organizations, the 100+ organizations that are part of that coalition, dependent on the intervention strategy that we would look to align with what was in the priority areas of the Community Health Improvement Plan. So Every grant is very different, is kind of my answer for you there. So it would just be dependent. So when we look at a lot of these ones, there's certain ones through the National Recreation and Park Association that were things to increase access to healthy foods. That was a $35,000 grant that was eligible to apply back in February of this year that we didn't apply for because we didn't have the capacity or the time, and we got it on such a quick turnaround to write a grant, but there was no match requirement for it. It would have been $35,000 to come in and try to see about updating and doing technical assistance, bringing in consultants to look at how could we revamp our policies, maybe vending, things of that sort, concession stands, looking at different options. So kind of skirt around all your question. Some grants, yes, would have some matching requirements, but some would not.
Another question, accreditation.
Yes.
Do we have a yearly fee for maintaining accreditation? Do we have to?
We do have a yearly fee. It's not as much as it was to apply. Can you tell me how much it is off the top of your head? Some thousands. It's not
To apply was
16. 21 to apply, and I think it's like around
maybe 8,000.
a year.
A year.
And it is, we have it in our budget. We did put it in there. So.
And what benefits do we get from them, other than their oversight?
Their oversight. So I think the benefits we get from them really is advice as much as anything. It's like, yes, you're doing well with your strategic plan, but your performance management plan needs this, this, and this in order for you to be a higher functioning health department. And so I think it's their expertise and keeping with those standards and keeping our standards up. So if there's documents that they think they partially meet the standard, but they don't completely meet the standard, those are the ones we're going to have to report on every year that we've improved, and here's how. So it's a built-in improvement plan. Yeah, so it just helps us stay up there. Do you want to add to that?
It's kind of like an outside audit also, that come in and look at your effectiveness.
Correct. And one of the other things that's a great benefit, kind of a segue from your grant question, is there are grants that would be at a larger scale, like a federal grant, to where they look and score you higher if you're a FAB accredited health department, because you've been able to effectively show that you have the capacity to handle those types of dollars and that kind of work. If you are not an accredited health department and they didn't know that you had an improvement plan or a needs assessment or all those other plans, and you didn't have the internal capacity to handle that, you would be scored much lower on their rankings and would not ultimately be eligible for the most part. So that's another great benefit, would be the increased ability for us to ask for more funding.
Edith Gaines, Finance Officer with the Health Department. I just want to add that as more and more health departments become accredited, not just here in Kansas, but nationwide, then patients come to expect a certain level of service. And so with us being accredited, they would know that they're getting that same level of customer service and treatment as other health departments across the country.
Thank you. Yes. If you've seen one health department, you've seen one health department. So, Tim, did you want to add any more to the grant writer or any comments on that too?
Tim Laurent, Shawnee County Parks and Recreation Department. The only thing that I would like to add, and I'm guessing that Commissioner Rippon, at least I'm hoping he'll agree with me, that it's been my experience that in Parks and Recreation Departments specifically, and probably in health departments, that the person that's given the responsibility to write grants also has a host of other responsibilities. And grant writing ultimately ends up, in my opinion, falling through the cracks. It takes a lot of time to do. It takes a certain level of expertise to be successful at writing grants. And so I think that to me is where the benefit would come in, is that we would rely, I don't think we would be able to hire somebody specifically as a grant writer in our department. But by sharing that position with the health department, I think we'll be able to keep that person busy enough, and we'll rely on their expertise and their ability to have time to focus on this would be a big benefit to both departments. So,
Do you have a person on staff right now that's writing grants?
I do. Yes, and he's also in charge of all of our contracts and a lot of other things. And so subsequently, we don't spend enough time on grants.
It's something I don't miss.
Commissioner Cook.
Just a couple of questions maybe for Linda on your budget. As we go to all the EMS records, you've only got a budget at $1,000 from computer hardware. Are you not anticipating needing to do any computer upgrades over the next year?
Looking at Nancy.
EMR, I'm sorry, EMS, but I meant EMR.
So hardware for the EMR?
Right.
No, we should have what we need, pretty
Okay.
much. I think we're buying some hand scanners and,
I
yeah.
mean, we spent $519,000 last year in the software, but this year, I mean, we've only budgeted $1,000 for hardware. So, I mean, are you not anticipating and needing any computer upgrades over the next year?
We should be good shape for, the only thing we may have to get is laptops, two more laptops, but we think, we just,
But our hardware is going to be more than $1,000.
well, that's not what the budget says, so.
Well, the budget was last year,
Um,
and that's for.
You're talking about this year's budget?
I thought I was looking at this year's budget. It's on,
For 2020.
Yes.
2020.
Yeah, sorry, for 2020.
You might make sure, we have a whole lot of different line items.
right, right.
on
No, I was
that
looking at
thing,
the
so-
master one.
Okay.
What I'm looking at is Form AK, line 50375.
We've got
But
$10,000.
they're-
Oh, that's 2018, we spent 10,000, and 2019, we've got 4,200 budgeted, and in 2020, we've got 5,800 budgeted.
Okay. Maybe I was off on looking at the 1,000. But is still that going to be enough for the laptops that you want to buy?
We anticipate it is going to be enough, yes.
Okay.
I think we're in pretty good shape for hardware.
All right. And then finally, are there any costs that you can draw from to spend out of your reserves? I mean, having reserves is a good thing, but the health agency has a very healthy reserves.
Yes, we do.
Is there any way that we could reduce some of the expenditures, such as computer hardware, by using our reserves rather than having it part of the general fund?
So we have budgeted using reserves. We budgeted this year to use some reserves and not ask, of course, we're not asking again for an increase in tax allocation. But then we've had so many open positions, we haven't needed it. That's where we're struggling, is our open positions. Yes.
So for the EMR implementation, the first year costs and the implementation costs, all the training and some of the hardware, that is being charged to our reserve funds for 2019.
Had that set aside though for that. That was a special, we had that as a special revenue fund, remember?
Right, but he mentioned the computer
Right.
technology account, so that will be used.
For the
Yes.
electronic.
The underlying concern that I have, to be very blunt, is we just don't have a lot of gap of unallocated. If we were just to give the base of what is being asked for without getting into any increases, there's such a small gap that's available to the commission. And so if there's ways that we can even temporarily, without raising the mill levy, and that's been the stated goal of the commission, is to not raise the mill levy for the 2020 budget. So if there's a way that we can cut back on a department that has healthy reserves, knowing that they would be able to use that reserves for that year, knowing that next year they would be able to come back. Again, I know that no one wants to see their budget cut, but I'm just trying to think, and again, this is the only time that we really have the ability to ask those questions in an open forum, not making any judgments or saying,
Sure.
what to do one way or the other, but I look at an agency that has healthy reserves. You've done well. You've been good stewards of your tax dollars. You've done everything we've asked you for. You've made great improvements and strides. But are there ways that we can use some of those reserves rather than continuing the flat budget allocation, which is really what you're looking at is even a reduction in the total, I guess the tax allocation amount is the flat budget. So is there any way that we can scale back that tax allocation just a little bit so that we would have that to allocate to social services or other programs that are in the community that might also affect things that you're doing?
Sure, I mean, yes, you certainly could. It would impact things like the state formula, which is one of the aid to local grants
Okay.
that's based on our tax allocation.
All right.
And so we would see a reduction in that also. And it would probably, I mean, I think I don't know. We could hear, I know there's been a lot of talk across the state about health departments are not being funded, and so I don't know.
And again, this is the reason why I want to ask, is that may be an unintended consequence.
Yeah.
Whereas the Shawnee County was just trying to cut back on the tax allocation, the state would then say, we're going to reduce your overall. And so, again, you try and cut off just a little bit, and you wind up getting cut a lot more. And so, again, I want to try and discuss
Sure.
that here, so that we're not sitting in that final budget. Because when it comes down to that final budget hearing, and Commissioner Rippon, you have yet to experience this. It's the fun part. You know, those are where the tough decisions are made, where you're trying to meet all the needs and you're trying to balance it all out. And there's too many needs than there are resources. And I'm just trying to look at where we're at.
We ever use vacancy credits for, we sometimes have a lot of open positions. I didn't know.
I don't know that we've ever used that concept.
You know,
No. But yeah, we get through with the budget and nobody's happy. That's typically what
Sure.
happens.
We've been happy,
Well-
but we were right, we're sitting on a healthy reserve. I mean, is there a way also to use the reserve to maybe grant some money to some of those other agencies? I mean, could we be creative, be bold and progressive? I don't, I don't know, I
We
mean,
have to be careful of that and what type of a fund it is for
sure.
budgetary.
And we would have to we oversee Medicaid match, and we know what that has done for us.
Right.
That's been very difficult. So,
Just as an example, this morning, the Extension Council came in, part of their budget is an increase of $14,000 on computer equipment. And they talked about how their 2010 computer went down, so they replaced it with a 2011 computer.
yeah,
I mean, we laugh, but I mean, that's where where they're at. So that's $14,000 of taxpayer dollars that if we were to use it for there, we can't use it somewhere else. And so, the unfortunate example that I give is, it's like having 4 children and you can only feed 3. So you've got to pick, which 3 do I feed?
I don't want to do that.
So.
Do you have anything more about the tax
Well,
allocation?
I was going to say, maybe instead of reducing the tax allocation, we could pay some back through indirect costs so that our state formula doesn't get decreased as well. That might be an option because we do help pay for administrative services, court services, counselor's office.
And we are in the process of getting an updated study for those indirect costs. And in all probability, those will probably go up anyway, because it's been
Yeah.
several years since we've had that done. And we kind of wanted to wait until the health clinic was, really
yeah.
gone and everything had kind of settled down. So we are in the process of looking to get that done here in the near future. So for 2020, they will probably go up when we get that report back.
Okay.
I will tell you too, we're going to have in the next 5 years, some really expensive people retiring, me included. There's that reference. So, I mean, we have money set aside for that also, but we haven't had to use it yet
Yeah.
for the people and we've had some expensive people retire, which is why you're going to see our grants go down. The WIC grant reduced quite a bit because we have some expensive long-term employees retiring. So, yes.
Mr. Chair, I have
Yes.
a question. You're showing these new positions you would like to add, total about 200,000. But you're also showing that your grant income is going down. How do you plan on absorbing that 200,000 into your budget?
I'm going to let Nancy address that. Uh-oh, she's looking at me. Okay, so off the top of my head, I'll tell you how I would answer that, is that we did allocate reserve into the budget this year.
Okay.
So that's how we would absorb some of it. I look at, like the MCH nurse, if we don't hire that, we're not going to get that full grant this year. That's where we're at because of, and she's going to explain those changes in indirects that they'll pay us. We had a big cut there too. But again, it's people retiring with long years of experience and at the top of the pay scales makes a huge difference to a department that's 72% salary.
Yeah.
Yeah, so that's, I think, what we're seeing.
So some of these new positions, you may be adding this new position, but there would be another position that retires that you don't fill? Is that?
No, I'm
part of it?
not
No.
talking about not filling any.
Oh, okay.
So, yeah, we're talking about going from
Just-
66.5 FTE up to 69.25.
Okay.
Yeah, so no, these would be brand new, except, well, the MCH nurse isn't new, it's been in the budget several years, but the others would be brand new, and partially grant funded, like the health promotion specialist.
Okay, thank you.
Okay, so we'll just talk about the budget a little bit, and I do want Nancy to visit with you a little bit about indirects. So again, we're not requesting, for the fourth year in a row, no increase in tax allocation. We are sitting on a healthy reserve, as you said. We did see a decrease of almost 300,000 in grant requests, and the reasons are, so we'll start with WIC, $160,000 difference because of retirements and salaries, a lot of it. The TB nurse and TB indigent grants went down quite a bit. That's because we haven't had a lot of active TB. So I'm going to knock on wood to keep that going. The early childhood block grant, there was a decrease. The public health emergency the FEP local, public health emergency local, went down $11,892. That was a painful cut in that program. That's making it hard to do the program. And apparently the state took some cuts from the feds. So that's what our grants are looking at, which is another reason I want to look at a grant writer. Our grants are going down. And so, yeah, we have to think about the future with that. And so Nancy's going to talk to you about indirects, because that did have a huge impact on us.
Hi, I don't know if I need to announce myself, but Nancy Mitchell, Accountant 2 at the Health Department. So we've talked a little bit about indirect, so I want to, before I start in, you guys all kind of understand the concept of administrative indirect costs. Okay, before I went in and, excuse me. So KDHE came out with new rules. I think they came to me on May 13th, and I was a little freaked out, I have to tell you, because our budgets were due in 2 days. And it had an impact. So what KDHE said was that the maximum amount of indirect rate that we could apply to the grants that we get from them is their federally approved rate, which right now for this coming fiscal year is 20.3%. Our last fiscal year's indirect rate that was approved was 29.43%. So that's what we had been using for most of our grants. Now we get to use 20.3. So we had a loss of indirect cost right there in that 9% range. Then they said, in addition to only being allowed to use their rate at a maximum, we can only use it on the federal portion of the grant funds, and they have to be paid out of the grant funds and not matching funds. So what that means in reality is the grants that we get from KDHE, some of them they are passing through from the federal government to us, and some of that is the state puts in their own money, and then of course we have our matching that we have to put in. So our grants, the way this kind of shook out, our grants are anywhere, the ones that we use these indirect rates on are anywhere between 34 and 44% federal, which means more than half of the grant money we cannot use those indirects on. And what we have been doing prior to this new rule was applying it to all three of those pools of money, federal, state, and our county match. So what this effectively did to us was told us that really the indirect rate that we get to use and that we get to be reimbursed for and count against our grants is between 5 and 17%, depending on the grant. And our estimated impact to our budget based on what we had submitted, not what we actually got awarded. I haven't had time yet to do the new calculations based on what was awarded. We just got those Monday of last week, and then I was on vacation. But the estimated impact to our budget that we did, and that is reflected in the budget we submitted to you, was $162,632. So it was pretty significant. and challenging, and it will be an exciting adventure to try to calculate and see, now that we have the actual grant awards, how we change our budgets and what that looks like. Are there any questions for me before I?
Reasoning behind this?
I mean, my crystal ball is as good as yours. But I think part of it is we had the new, I'm going to use the term super circular that came out, the new federal grant that really was effective last year, I think, was when it was actually effective. It had been out for like 2 or 3 years prior to that. So, but you know how sometimes governments, unfortunately, we work and we're like, oh, we get caught off guard by these things, even if we maybe shouldn't be. So I think they were kind of caught off guard, and they decided that they needed to get themselves up to speed and have that policy set. And I do think, based on how we've talked to them, we're probably the county that is impacted the most with this. I think several of the bigger counties get money directly from the federal government, so they get their own federally approved rate, which if we had that, we could use our rate and not KDHE's rate. And a lot of the little counties just don't even bother because it's too much hassle. As we've talked with some of the others, I think we're the county that's being impacted the most from this. But I would say their reasoning probably was that kind of getting up to speed and in compliance with that super circular.
Impact of programming?
Hopefully not. We're, again, kind of trying to see what we can use from our reserves to cover that.
Okay.
Thought that was important to go over that. So I will be bringing the aid to local grant to you all for approval, but this is the changes in award from last year, this year. I think state formula went down because the population went down a little bit. That's based on tax allocation and population. We saw a few little increases. FEP local was the big decrease. Because of family planning, it looks like we're getting more, but really, we're not. So that is not the case. This is what it looks like without family planning. The aid to local grant 5-year comparison. I don't like the way this trend is going. It's concerning to me because that's a lot of our programming comes from those grants. So we'll be watching that closely. And then again, we always show you the budget comparison and what percentage we are of the our tax allocation of $2,151,781 represents 2% of the county's total budget and 2.7% of the county's 2019 tax revenue budget. So even, no matter what you do with our tax allocation, we're a bargain. So I would be happy to answer any other questions, or we can discuss a little further if you'd like, what you'd like us to do
Commissioner?
with the reserve.
Finished.
Okay.
All right. Oh, yeah, I forgot the next slide. There's a good-looking group of people. That's from our Workforce Development Day. So, yeah, it's a great group of people. We actually bought those jackets with that award money we got for the HPV project a few years ago. We got the $5,000 from Immunized Cancer Coalition. That's how we started the jackets, so nice use of that money.
Well, I think Commissioner Cook is correct. We need to really look and see if there is an opportunity for spending reserves
Sure.
judiciously. I think that's what the thought is. Really, we made the decision 3 years ago, I guess, to aggressively bring salaries and compensation up to market level. And that's, and that was the right thing to do. Mm-hmm. And I'm glad we did it. But it does stretch us to keep the mill levy the same.
Sure.
And then provide better and market-based compensation for our employees. So that's why we have a tradition of taking care of taxpayers, providing good customer service, but also taking care of our employees also. So.
Mm-hmm. I totally understand.
Okay. Anything else? Betty, do you have anything? All right.
Thank you for your
Very good.
attention, right
Thank
after
you.
lunch, tough time.
Thank you. Thank you, Linda.
Thanks, Tim.
You are.
So you're famous in Des Moines and San Francisco? Is that what we heard?
Who would have thought, right?
Slightly unexpected, but, you know.
That's
Oh,
great.
that
No,
doesn't- Mark, why is that?
Greg, I will get you the address of that one guy that's having trouble with
The transportation.
the transportation issue.
thank you.
I gotta find this
There
letter.
it is.
I know it's on my desk somewhere.
perfect.
I will get you.